am truly excited to talk to everybody about building compassion fatigue resiliency. And this is really going to be the first public view looking at the tools and the preliminary data from the starter pack, the study that we're running on compassion fatigue resiliency. But I do want to first step back, ask everyone to kind of frame the issue of compassion fatigue, why it occurs in our field, why it's such an important issue to talk about. So many of us are in this field because we're passionate about answering questions, solving problems, and ultimately helping both people and animals. This means that we all have an intrinsic drive to be here, which is really wonderful. It means that we find a lot of meaning in our day-to-day work, but it can also mean that we have a difficulty separating our work and our life or balancing our work and our life. So this can make compassion fatigue, the fact that we care so much about our jobs, about the animals, about the research, we are more prone to compassion fatigue. And of course, we form bonds with animals in the laboratories, but as often, which is an unavoidable part of the research that we do, we must design, approve, perform, or view stressful or painful procedures. None of us want this. None of us want this to occur in and for itself, but it does happen as a necessary part of answering our research questions. And this can result in what's called perpetration-induced traumatic stress. This is somewhat like PTSD or post-traumatic stress disorder, where we have stress ourselves that results from causing harm to others. Again, we don't want to do this, we care deeply, but we also, as part of potentially the research question, are faced with this unavoidable fact of the experiment. And partially due to this, as well as other factors, we might experience what's termed moral stress or emotional dissonance. Moral stress occurs when our internal values do not match our external actions. And so this can occur like with the former slide about, believing that, we have a moral code of not harming animals, but we may have to as part of the experimental design. It may also occur, say I had pet rats, maybe what I believe, what I really want is that rats to be housed in big cages with digging opportunities, with climbing, with lots of human-animal interaction. But my reality is I work in a very normal research lab that has a lot of constraints, and the rats are housed in normal shoebox cages. And this conflict can end up causing some stress. Emotional dissonance occurs when our internal emotions do not match our external expressed emotions. Again, maybe we feel negative about some things with the studies, maybe we feel sad about a euthanasia, but we don't necessarily express it. And so in my previous research, I did a large cross-sectional study in 2018. We really do find that both human and animal welfare are intertwined. We found in that study that there is an association between people reporting animals in higher stress and pain levels. Those people also report higher compassion fatigue. People who report that their animals receive less enrichment, frequency, and diversity also report having higher burnout. And those individuals that do really wish that they could do more for their animals in terms of enrichment also report higher compassion fatigue. So this is partially why the North American 3Rs Collaborative is so passionate about compassion fatigue resiliency, as well as myself personally, is we really see this direct connection between the human mental health in our field and the animal welfare and the 3Rs, that we need the people in order to do the 3Rs and enact it. Beyond that, we know a lot of stress occurs in the field when our bonds with animals are broken. We may experience what's called disenfranchised grief. This is, feeling a lack. This is when our grief is not recognized by society. We may feel a lack of empathy, lack of organizational support, sometimes even disrespect. People might not understand, oh, it's just a mouse, it's just a rat that you euthanize, it's just part of your job, why are you so upset? Or what's worse is, sometimes people look at it with disgust. You euthanize animals. I can't believe you do this work. During the COVID-19 pandemic, seeing when we had mass euthanasias, discussed rather than, this is really hard. This is really support. I'm going to really connect with you. And so this can be really challenging in our fields. And just generally, we may not feel supported or valued by our friends or society in our work. And now there's been at least 3 studies in our field specifically finding this association between feeling social support, feeling lonely, and then also feeling compassion fatigue, that this social support is really important. Just like many of our research animals that have required social housing, we're also very social species, and how we interact with others in our lives is extremely impactful. Also, as some of you mentioned in the beginning in your wins of having more staff, right now, especially more than ever, we might be working longer hours and in understaffed workplaces, which obviously can be quite stressful. So all of these factors can lead to workplace stress. And we know in the human medical professional field, it has multiple negative effects. For the individual, it can increase depression, exhaustion, poor relationship health. For the workplace, it can decrease patient satisfaction, quality of care, increase medical mistakes. For the workplace, it can increase staff turnover and increase absenteeism. And so this is really important not only for the individuals, but also for us as a field. And when I talk about workplace stress and we talk about compassion fatigue, I think it's important to know what we're talking about. So I typically think about professional quality of life. This is a validated scale theory developed by STAM, and it really splits into 2 parts. First is compassion fatigue, and second is compassion satisfaction. That compassion satisfaction is really feeling good about your work, really feeling meaning, satisfied. It's our positive feelings. Whereas compassion fatigue is more of those negative feelings. And it's typically thought to be comprised of 2 main components: burnout, which most of us can be familiar with, unfortunately, being exhausted, depressed, frustrated, just burnt out about our work. Or secondary traumatic stress or perpetration-induced traumatic stress, which is about being exposed or causing stress to others. And like I said earlier, is similar to PTSD, which can result in invasive thoughts, nightmares, hypervigilance, and avoidance. So these are really the 2 main definitions. And I did want to go over that as we go forward in the talk. But now, as I started with a little interaction and engaging with you, I want to engage again. I do think it's important to build community. So if you feel comfortable in sharing, I would love to hear from people. Just reply yes in the chat if you've experienced compassion fatigue, burnout, workplace stress. I know I've experienced some symptoms of burnout in particular at times in my career, and I'd love to hear from you. I am seeing currently a lot. Yes. Yeah, especially, right now we're really, we are seeing a lot of burnout, especially in today's day and age. We're less connected to our peers. We're working long hours, we're overstaffed, we have all of these factors. Yeah, I see a lot of yeses pouring in. So hopefully if you're on this webinar today, this helps you at least feel less alone. You are not alone in feeling these things. It is not bad to feel these things. It is normal to feel workplace stress. It's maybe not desirable. It's not necessarily what any of us want, but I do want you to feel a sense of community and a lack of aloneness. And hopefully in some of the introduction, my goal with that, beyond just introducing the topic, is to give everybody here today just some validation, some terms, why do I feel this way? What might be going on? And so hopefully you have received some of that today. So that's kind of the negative side. And thanks everyone for replying. I really appreciate that interaction. So that's kind of the negative side. So again, like I just said, you know, it's not bad to feel these things. It's okay. And in some ways, it's somewhat expected that you might feel this way at points. And so our goal is not necessarily to totally eliminate compassion fatigue. That's probably unrealistic, but rather it's to promote resiliency, to promote an ability to bounce back and to move forward. And I want to start with the premise that we all want this. I don't think there's really a leader out there that wants their staff or wants other people in their work to be stressed, to have compassion fatigue, to be burnt out. Nobody wants that. But just because we want to promote resiliency doesn't mean that it's easy to achieve or it's an easy goal to achieve. So again, I'm going to just invite a little bit of interaction. I want you to type A in the chat if maybe you've said either for yourself or your institution that you wanted to do something to promote compassion fatigue resiliency, but you weren't sure exactly what that was. Either for yourself or your institution, there might be some reasons, you know, evidence, impact, practicality. I do see a question, can we get a copy of your slides? I will be recording, well, I am recording this lecture, and so you will be able to access it on our website. And so I see a couple A's, you know, people who want to do more to promote resiliency, but they might not be quite sure what that is. And sometimes that's, you know, what is really going to be the most evidence, what's going to have the most impact, what's going to be the most practical. So that's kind of situation A that I do see a lot. That's very common. The second thing that is also very common, and feel free to keep typing A, feel free to type B as well, is that maybe you have a pretty good idea about what you should do, what you could do for, again, either yourself or your institutions, but you run into roadblocks. Maybe it's difficult to find the time. Maybe you don't have the manpower, maybe you don't have the training. Maybe if it's the individual, it can be difficult. Oh, I know I should do these things for self-care or for myself, but it's hard to get motivated. It's hard to keep that accountability. So yeah, I'm seeing lots of B's. Again, this is pretty normal. Or at the institutional level, you know, people want to start something with their institution, but they just don't have time. They've got a list that's very, very long. They're not sure how to get started. It's hard to prioritize. So we see that a lot. And then the third thing, and I'm really actually interested to hear this as well, is type C if you feel like you have had some success. Again, either for yourself or your institution, maybe you have a program, maybe you've done some things individually, and you have had success. And even in these cases, we do find that, you know, people have done good things and they want to share it. They wish that they could tell people what to do, but again, they may not have time. They may not have the venue. We can learn from these people. But again, it can be challenging. So yeah, I'm seeing some C's as well. Definitely. Awesome. Thank you, everyone, for that little bit of engagement. It's always good to see kind of where people are at. And so this brings me to the North American 3Rs Collaborative, which I know is a mouthful, but we were created by people who understand these three kind of situations firsthand, not only for compassion fatigue resiliency, but for all 3Rs implementation. You know, either A, we're just not sure what we should do, B, we're pretty sure we know what we're going to do, but we have trouble getting there, or C, we have actually done the thing, but we haven't had the right venue, the right way to share our successes with others and help them forward. And so we were created by people who understand these situations. And that's why our mission as a nonprofit is to advance science, innovation, and research animal welfare through collaborative 3Rs efforts focused on refinement, reduction, and replacement. And our strategy to do that is to really partner with people like you across the field. This is a picture of our leadership team and our board of directors, as well as their institutional logos. And I hope that you can appreciate that they do span across industry, academia, government, other nonprofits, consultants, and more. And that's just our leadership team. We actually have over 140 individuals on our different initiatives that are working with us, understand these 3 issues, drive solutions forward. And really, when we're looking for initiatives to focus on, we have 3 main lenses. First, we want to look at strategies that do have strong evidence behind them, that we have good reason to believe that they will work, that it's not just one finding from one lab, but that it can be successful. Second, we look for strategies that will have a big impact, either for a lot of animals in maybe a somewhat smaller way, or a fewer number of animals in a big way. We want to have those big impact solutions. And then third, and really extremely important to me personally, is this real world practicality piece. I love to dream about what could be in the research animal field, to see where scientific research is headed generally. But I think to make progress, especially at scale, we need to stay grounded in the everyday reality and think about those barriers, think about those opportunities, think about what really can work. And so this is really how we define our initiatives. We currently have 6 key 3Rs initiatives focused on rodent health monitoring, microphysiological systems, translational digital biomarkers, refinement, creation of a 3R certification course, and compassion fatigue resiliency. And I will briefly highlight all of these later in today's talk and how I really believe all of them can play into compassion fatigue resiliency. But I am, of course, going to be focusing on that compassion fatigue resiliency initiative first. And first and most importantly, is I do want to acknowledge that it does take a team. This is a list of the 29 individuals from 22 different institutions that are on our Compassion Fatigue Resiliency Initiative. We put out a call last summer to ask for volunteers that either had their own programs, had done research on the topic, or just were extremely passionate about the topic. And they all came together in late July. We discussed it as a group, and we decided to focus on creating resources for institutional compassion fatigue resiliency programs. Certainly, we could have just focused on, reaching the individuals only or primarily, but we really think that the resiliency piece is not just the responsibility of the individual. Of course, we do all have a lot of control over our own mental health situation. We are first responsible for our frame of mind. But if our institution is not supporting us, doesn't have a culture, doesn't have a program to replace to support us, it can be difficult to stay resilient. And it's important. We really thought we could reach the most people in the biggest way by focusing on the institution. So we got started last July, and within about 4 weeks, actually, we wrote and submitted and ultimately received a small pilot grant in Occupational Health and Safety from the Northwest Center at the University of Washington. This is a small grant. It only goes through about June of this year, but that's really helped us kickstart this program to really get off the ground with us. And then we're really hopeful to get continued funding from other institutions so we can continue going forward. And our objective in this program was twofold. First, as I mentioned before, is we really wanted to create resources for animal resource institutions. And second, we wanted to formally assess them, both in terms of their quality, just the reception, be able to review them, but also their effectiveness. So we built what we believe to be a pretty comprehensive compassion fatigue resiliency program. At the high level, it has 4 main components: a longitudinal survey, starter pack resources, these are written packets, guidance, etc., interactive webinars, and finally a poster. And I'll go through each of these in more detail. So first of all, we created this mixed methods online survey. And the mixed methods is very important to me. I think this is the strongest methodology for looking at human behavior, human perspective. With the qualitative questions, we can get what's really top of mind for participants, really get what they are thinking in the moment. But with our quantitative close-ended questions, we can really use validated scales. We can look at effectiveness over time, and we can just look at the field and be able to compare across different situations. For timing, we did this survey at baseline. We actually just started this at the end of February, early March. So when I say this is a preview, this really is, we are in the middle of really the intensive program right now. So then we're going to have one at 6 months. This is all partly due to the granting timeline. We have an intensive 5 months. We're going to look at, after that intensive 5 months, how participants are doing, and then at 1 year and at 2 years. We replicated questionnaires from validated instruments whenever possible. We looked at the ProQOL, the perceived stress scale, a resiliency scale, job satisfaction scale. We took a nurse retention index and modified it for this field. And then, of course, the qualitative data. And with the retention data in particular, we actually look at not only retention in terms of, do you want to stay in this field? We also wanted to look at, do you intend on staying hands-on with research animals in particular? Because we know that that piece is sometimes the most challenging for people. And so I won't present on all of this data today because it is still pretty early on, but I'll give you a look at some of it, and I'm happy to answer questions on others. This is our poster. We're pretty excited. We worked with the designer on this, and we sent to our pilot institutions posters to post around their animal facilities. And this is really important piece because we do find, and I'll present later, that this normalization, this validation, this valuing of employees is really important to their mental well-being. And so we want to have visual reminders of this in the animal facility that, acknowledges that the work we do is hard, that acknowledges that we can move forward, that there are positive aspects, and then that QR code links to our resource hub. We are facilitating monthly webinars for the first 5 months for our pilot institutions. So I started with an introduction to the topic. Dr. Heather Hirsch talked about mindfulness. Dr. Julie Squires actually just yesterday talked about creating great work relationships. Beth Greenhoe is going to be talking about culture of care next month. And finally, Dr. Lisa Kelly is going to wrap us up with a little bit about making meaning in the field. And this part we thought was important so that while institutions are getting their own internal compassion fatigue committees, getting everything set up for themselves, that there's something to kick off the program. And these were some of the topics that we thought were really important regardless of the institution and that we could provide virtually. We do try to make these webinars as interactive as possible as well. And we've had pretty good response to them. Like I said, we also have our starter pack materials. So we have what we term our core components packets. This gives institutions a suggested timeline, guidance on forming a committee, including guidance on who should be on the committee, examples agendas, example charters, and what to expect. It provides sample budgets. It provides guidance and advice on getting leadership buy-in, as well as an editable slide deck. And it also includes a manager's role in a wellness program. And I have this highlighted because we will be revising these materials, and we're considering actually taking this out of the core components packet, or at least having a supplement so that it can be printed, really emphasized, because we do know that the managers play a key role in employee wellness. Beyond those core components, we've got a few more support materials. We've got this learning resource packet that's really meant to be printed, put in break rooms, distributed to participants, that just teaches them a little bit about that individual aspect of compassion, fatigue, resiliency. We're going to have a packet on culture of care, as well as a packet, potentially a web page about activity ideas. So after those first 5 months, the institutions are encouraged to host monthly activities, and we're going to give them some ideas and guidance on what to do so that they're not having to brainstorm themselves. Also, as part of the program, we already had the most detailed resource page on compassion fatigue, but we recently updated it to become a resource hub. So now not only does it have kind of this background information, it has a section for recorded webinars, research papers, self-care classes, self-assessment. There's a whole bunch of stuff on here. This is open access. Anyone can do it. So if you are interested in learning more, check out this hub. We're also probably going to be adding to it, expanding to it. So like I said, we kind of have this intensive first 5 months for our pilot institutions, and then after that, we'll be providing more hands-off support, more for, you know, just as questions come up. And so I'm sure many of you, hopefully, might be thinking, wow, that sounds really great. How do I get my institution signed up? Well, right now we are in the midst of holding this formal longitudinal pilot, so we're not releasing any of these materials wide scale right now. We also want to revise them based on feedback and really be thoughtful, intentional about what we're recommending. So we are still discussing wide scale release. I anticipate that being either late this fall, early next year. We're also still discussing potential pricing. We'll likely have some materials accessible for free, some materials that may be more resource intensive on our side that may require some small payment. Again, that's being discussed. Sign up for our newsletter or contact me directly if you want to learn more, to stay up to date. I also have a list of institutions that are interested. So yeah, that's the program. Feel free to put questions in the chat. I'll get back to them at the end of the webinar as well. I will just check the chat to see if there's anything here. Okay, so I don't see any questions at this time. I'll address more at the end. So now for the exciting part, also for many people, if you like data like me, is the preliminary results. So like I said, we just collected this baseline data in March, and it's only May now, so it is still quite preliminary, so no guarantees that what I present today will be in the final manuscript, but it's at least a start. So of course, we'll just be doing baseline. I'm primarily going to be focusing on that qualitative data. So first, what was our sampling frame? Who did we actually get? So we have 7 institutions in the United States and Canada. I'm going to share the names of those that I have permission to share. 2 are academic, including Georgetown University. 1 is a hospital, and then we have 4 industry, including both Neuralink and AstraZeneca sites that are participating. So we really like that we have this mix of both academic, hospital, industry, because we know, you know, just the situations, what goes on is a little bit different in these different types of facilities. We generally analyzed our data with descriptive statistics, thematic analysis, which is our qualitative data, and general linear models. The one association that I will present today, again, very early on, is going to be on the dependent variable of burnout, just the raw data. But we do look at demographic factors. We controlled for that, and then I'm going to look at a few explanatory variables as well. We did get 199 individuals that replied with enough data for us to analyze. And the only demographic that I do want to pull out that I think is pretty exciting is that we actually got both 30% caretakers and 30% researchers to reply. And this, I think, is really critical because often these discussions about compassion fatigue resiliency really reside in the lab animal field. And sometimes researchers can get left out of the conversation, even though they also are just as susceptible to compassion fatigue somewhat in different ways. So we're pretty excited to have the large percentage of researchers in this survey. We also have managers, technicians, that's Aya Cook, and others. So this is the first bit of data straight from the statistical program. And this slide is really to just show you that in terms of both burnout and secondary traumatic stress, we do see a range. So from a data analysis standpoint, this is good because this will let us explore associations, what is going to push someone to higher levels of burnout, to higher secondary traumatic stress, and what might help people be on the lower end. So this is generally a good thing. I will also note that we aren't necessarily seeing, in terms of the raw score, super high levels of burnout and secondary traumatic stress from our participants. Of course, some of this might be a sampling bias factor. You might be less likely to fill out a survey if you're extremely burnt out or have really bad secondary traumatic stress, but unfortunately, there's not much we can do about that. And we still want to see that we can lower this. The other thing that I do want to emphasize, this is looking at compassion satisfaction, and really that just what I want to communicate with this is generally we see pretty high levels of compassion satisfaction in this field, which is a really good thing. It means that we are seeing a lot of meaning in our work and from our participants. Now to go into that very preliminary association analysis, we did find that burnout was associated with several factors. So people that reported higher stress also reported higher burnout. People who reported lower resiliency had higher burnout, and people that were less satisfied with their jobs also reported higher burnouts. Additional factors, people that were younger, who worked more years, who worked more hours, all reported higher burnout. And those that were working with animals experiencing higher stress and pain reported more burnout. And those that were working hands-on with animals were reporting more burnout than those working hands-off. So that's, again, just that preliminary association analysis of our data. Now, I do want to talk a bit about the qualitative data, and I'm just going to present two questions. The first one that we asked participants was, for you personally, what, if anything, makes compassion fatigue occur or become worse? And I do want to go ahead and shout out to Lauren Young at University of Guelph. She is a graduate intern that I've been working with for quite some time, both on this project and another one. She coded this data. She coded some of it. For this question in particular, she just got this data to me yesterday. So this is, again, very preliminary, but it's also very exciting. So for this question, we really saw responses falling into three major categories. So we did read through all of the responses, kind of look through to see what natural themes emerged, and then categorize them as such. And by and large, we saw that organizational culture was actually beat out just by a couple percent in this preliminary analysis as the most impactful thing that made compassion fatigue worse. And things that people said were related to feeling undervalued, having difficulty with other staff, work-life balance generally, and then just kind of related to that understaffing and not feeling like they had enough time. The second category was related to research animals in specific. So lots of people said, euthanasias were really hard. Some of them did mention things related to the 3 Rs, being concerned about the levels of enrichment, the levels of refinement. People were concerned about translation. They said it was really hard when they felt like the models they were working with were not translating to either human or animal medicine in the real world. Human-animal bond, research procedures, and just also openness. So people felt like not being able to be open with the public about their work, that their institutions weren't open, also made compassion fatigue worse. And then finally, just the general mental health category was like counseling, just having poor self-care, etc. The second question that I'll go over today, and this was asked more towards the end of the survey, was what, if anything, do you feel would be the most beneficial aspect of an institutional compassion fatigue resiliency program? And I actually want to go ahead and jump on the chat, and I want to see again from you guys, what do you guys feel would be most beneficial if you guys were thinking about starting a program? And then I will reveal what the participants said. Employee retention. Yep, so that, researcher input and support. And also we were kind of looking, what would help people? Yeah, improving culture, support. Good. Administrative support and resources, safe places to openly discuss, good feelings. Great, thank you. Culture of care. Counseling, yeah. So feel free to keep on going in. So what our participants said, again, this is all coded by Lauren, was 3 main categories: organizational culture, general mental health, and compassion fatigue. So across all the sites, participants generally believed organizational change was the most important part. So again, very similar to what would make it work: better work-life balance, more staff, more pay. Some people actually said they wish they had more required training, which I thought was interesting, because often those of us creating the training often hear like, oh, I've got too much training. So that was interesting. More communication, effective leaders, again, transparency with the public. For general mental health, counseling, coping strategies, supportive communities. And finally, compassion fatigue. So again, people, this was still an important component. People wanted things to be normalized. They wanted to be able to talk to others. They wanted tips, and they wanted education. So really the preliminary takeaway I have from this data is that compassion fatigue is really affected by more than just our unique work with animals. I think it's really common. I've been prey to this, to when we talk about compassion fatigue in this field, we focus about what is unique about working with animals. And that's certainly important. That clearly is an important part of the discussion, but we also need to remember that organizational culture and just general mental health support are likely incredibly key in promoting resiliency. These baseline skills, these things that, again, are probably not necessarily as easy as just, here's some quick tips, here's some education, but are very, very important. So that brings me to kind of the last part of my talk. So that's our data. What can we really do to promote it at the institution? So at the workplace, whatever we can do to just improve the workplace is going to be beneficial. Supporting work-life balance as much as you can. Again, many of us don't have control over this, but making sure we're fully staffed, providing adequate pay, training managers, promoting good communication, increasing openness with the public. Providing general mental health resources, counseling, coping strategies, building communities. And then in terms of the compassion fatigue specific, we do still think that creating a compassion fatigue resiliency committee to take the lead is going to be one of the best steps. That committee can help promote training, promote continuing education, acknowledge compassion fatigue, and normalize and give some helpful tips. But then I also do want to just emphasize that we really think, and we see this already emerging in the data, that promoting the 3 Rs will likely benefit compassion fatigue resiliency. And so I do want to talk a little bit about what our organization is doing to help institutions and individuals like you promote the 3 Rs in your institutions. And I'll start off with refinement. So we do have a refinement initiative that initially has created these high-level evidence-based resource pages for most of the common animal species. So if you are looking for new refinement enrichment ideas, go to our website, check these out. Again, they're meant to be really high-level, brief, to the point, and then you can dive into the topic in other places. We also are really promoting refined mouse handling as this evidence-based, impactful, and practical refinement. Just in case you haven't heard of this, technique. It's about picking mice up with tunnels or cupped hands prior to doing normal procedures. So you pick them up, then you restrain them, you give them injections, you do whatever you need to do. It's just about that first interaction. And we do really find that this has evidence and impact. Over 15 different measures from over 10 years from independent labs support its use across the animal welfare frame, the scientific welfare or scientific quality frame, and more. We find that it's practical, even for those large institutions, both in the UK and in the US. We've got reports from a lot of success. Of course, it takes time in the implementation process, but people wouldn't say they'd never go back. And I do want to emphasize again that I really believe that implementing these refinements helps both people and animals. This is a quote from somebody in our research studies. They talk about teaching mouse 1, having mouse bites originally, which was obviously stressful to everyone. But since moving to this technique, not having any mouse bites, that being good for the mice and good for the handlers. People also talk about having fewer cage escapes, staff reporting enjoying their work more, and the colony having less aggression. So this is one case study of one refinement, but I think this can apply across many different refinements. And we know that this, changes like this are not easy. That's why we've created all of the things for compassion fatigue resiliency. We're doing similar things for all of our initiatives. So we do have this kind of benchmarking survey as well. We do like to be data driven. We are scientists. That's kind of in progress. Thank you. Also, it's actually going on right now. So if you haven't filled out the survey, it is posted on the ALAS Open Forum and other places for you to access it. We've got some LAS Pro articles. We have panel presentations, we've got our species pages, and again, we're creating these resource hubs that have things like downloadable and editable slide decks that have answers to FAQs, that have webinars, that's hopefully trying to make things a little bit easier. So that's kind of the refinement piece. Oh, and also stay tuned, we're thinking about creating a certificate course with the NC3Rs and Jane Hurst on refined mouse handling, and also separately creating some blood collection resources. For replacement, wherever we can replace our animals altogether with scientifically appropriate technologies, that's going to be beneficial for our staff as well, because they're going to see that commitment to the 3 Rs, and then that's less animals that they potentially have to euthanize or just see under stress and pain, which is really beneficial. So we've got 2 initiatives focused on this. The first is on rodent health monitoring. And this initiative really focuses and encourages institutions to replace their soil bedding sentinel rodents with environmental health monitoring. Again, we see this has strong evidence with over 20 peer-reviewed publications. Big impact, most institutions can use 100, thousands of sentinel mice each year, and that it's practical. We know of over 11, 12 institutions that have switched successfully, and again, they say they'd never go back. Again, like before, like with compassion and fatigue resiliency, we're really trying to create beneficial resources to make that switch easier. We've got this resource hub. It's got presentations, publications, slide deck, downloadable and editable SOPs is our newest one, FAQs. We've got a LAS Pro article. We also have a systematic review in progress for this. And again, we've got this benchmarking and barriers survey. And I am excited to share with all of you, and if you've seen our communications, we've said this before, but we are so excited that we've helped 5 institutions switch, thereby replacing over 8,000 rodents a year. And again, that's 8,000 rodents that your employees do not, employees across the field do not have to euthanize. They don't have to go through that process. They feel better about what is being done, and that helps their job satisfaction. We also have an initiative focused on microphysiological systems. Some people term these organ on a chip. They're complex in vitro models, 3D tissue models. And this initiative really seeks to increase adoption and regulatory acceptance of MPS in coordination with animal studies. We primarily focus on developers. We actually have 40 institutions, 28 developers that are members of this. And again, we've got a lot of different resources. We give presentations to both introduce microphysiological systems and accelerate regulatory acceptance. Again, you can go to our webpage. If you're new to these systems, I gave a webinar a couple weeks ago, kind of with this high-level introduction. Also, if you're a member of the IQ MPS affiliate, we've got an ongoing organ-focused webinar workshop series that you can learn more about those specifically. We're also really focused on this regulatory piece, so I've now given 2 presentations on that topic, and we're going to be putting out 2 publications on MPS overview and regulatory guidance. The final main piece for microphysiological systems is our technology hub. So again, if you're interested in learning more, looking at what providers are out there, you can use it to sort by tissue type, and it's on our website. We have one initiative focused on reduction and refinement, that's translational digital biomarkers. And it's focused on really non-invasive home cage monitoring technology that automatically collects physiology and behavior. This initiative is really exciting because it connects both technology providers and end users. And again, focusing on that translation piece, we actually saw some people in the survey that, knowing that their work is truly translatable is beneficial for their compassion fatigue resiliency. Again, lots of resources. We actually just published a peer-reviewed manuscript that has a checklist for engaging with these technologies, figures on the value assessments, on the timelines, and more. It's really meant to be very user-friendly. We've got some educational resources coming up. We've got webinars. We just hosted our first in the last 2 weeks, and it's recorded on our website. And we're going to have a technology hub as well. Last but certainly not least, we've got another all-encompassing 3Rs initiative, and that's creation of our 3Rs certification course. And we're developing a virtual, self-paced, interactive, about 5-hour course for all stakeholders. It's going to be released late this year, and it is North American centric. We're actually just getting ready to put it in the software now. It's got pictures, it's got little activities, it's got quizzes, it comes with a certificate at the end, and we're also going to be nailing down both the individual and institutional pricing, but we expect that to be fairly in line with, say, City or ALAS courses. But overall, really what I want everybody to take away from this webinar is that human and research animal welfare, as well as the 3Rs, are truly interconnected. When we focus on our people and give them the resources to stay resilient, to not get burnt out, to be satisfied in their jobs, they are going to have more to give to the animals. And when we focus on the 3Rs, on the animals, on translation, on refinement, reduction, replacement, then our people are going to feel better about the work they do and feel more satisfied and less burnt out. So it really is both together. And so I do just have a couple call to actions here at the end. Again, check out our resources. We've got a lot of them. Subscribe to our newsletter so you don't miss new ones. You can follow us on social media for bite-sized pieces. We also contribute to a podcast with the NC3Rs and Lab Animal that highlights 3 peer-reviewed publications in 3 minutes. Again, you can find that on our website. And I do want to thank all of our current sponsors. We are a nonprofit that primarily operates off of institutional memberships and donations, some individual memberships, and so we could not do what we do. My position coordinating all of this would not exist without them. So we are so thankful. And so we do invite you to join us in our work. Champion the 3Rs in your work. Encourage your institution to become one of our members, and if you're able, become an individual donors. For institutions, the benefits are becoming a growing network of our supporters, publicly demonstrating your commitment to the 3Rs, being aligned with leaders in the 3Rs field, supporting our resources, our conferences, our webinars, and collaborating through our initiative membership. You can donate personally on our website with the donate button. And with that, I would just like to invite anyone that does want to follow up with me, set up a meeting, etc. You can always email me. I love hearing from you, even if it's just general feedback on the webinar or otherwise. I love to see you in my inbox, and so I invite you to do that. And then with that, I just want to invite any questions. Go ahead and type them in the chat. I'm happy to answer them about whether they're about our compassion fatigue program, the North American 3Rs Collaborative, any of our other initiatives. Really great to see everyone on the call today. Really feel the community. It's really wonderful to hear from everyone. So let me just look at the chat. Okay, so I see the first one. I think that in many cases, some animal care staff might not realize that they have compassion fatigue or cannot put a name on it. Is there a simple survey they could answer to see that it's an issue that the organization needs to address? So yes, on our resource hub, we actually have a tab that says self-assessment, and we actually have 3 different quizzes that people can take online, automatically get their results linked on there. So that's a really great resource. Interested to see what is and can be done to encourage systematic validation of replacements to provide stronger evidence base. Yes, our NPS group is doing really great work. Yeah, we just presented more on validation and regulatory acceptance last week. So yes, how do we get on the list for the training materials when they come available? So we've got really there's really a couple different ways you can stay in the loop. First, just generally our newsletter, we put it out twice a month with any new resources. So that's like the first and best way to get our open access resources, is just stay on that newsletter, look at it once a month, we'll promote them there. The second way is you can always email me directly. I do keep a list of institutions that are particularly interested in our compassion fatigue resiliency materials. So I have an ongoing list. So just email me to get on that. I'm going to put my email in the chat right now. Also for the 3R certificate course, I don't currently completely have a list for that, but you're welcome to email me and I will start a list if you want a particular notification when that course gets released. But again, we'll be promoting that in our newsletter, likely at ALAS as well, at our booth that we will have. I also do want to mention that we will have a panel session at ALAS on compassion fatigue resiliency. It will be different from this talk. First of all, it will have much more complete data from our survey. It's also going to go a little bit more into actual strategies of what institutions can do and what exactly, it's actually going to give you more of a detailed inside look to the materials versus kind of, I gave you just today that kind of overview of the entire program. So if you're interested and are attending ALAS this year, we'd love to see you at our session. What other questions might people have for me? Again, they can be compassion fatigue related, they can be initiative related, really anything 3Rs related. I'm happy to take them. And thank you everyone already for just being so interactive today. I see over 90 participants today, which is lovely. I know we had over 200 signed up, so it's great to see. Yeah, I know lots of people are saying this is an issue. The study that I did with Dr. Brianna Gaskell and Dr. Maggie O'Hare and Dr. Sylvie Cloutier on compassion fatigue was the first cross-sectional study in this field, and that was back in 2018, published in early 2020, and then we've seen a lot more publications come out, and you can see them on our resource hub. And if you have things to add, if you have a new publication that comes out and you don't see it in our resource hub, please do speak to me or email me and I'll add your publication. So question, how can we get a speaker to present in person to our animal care staff? So we actually have 3 recommended consultants that we list on in our resource page. I'll just put that website here. It's www.na3rc.org/cf. And we have a classes and consultants tab. And so we have 3 different consultants that I know will come to the institution, that will speak to individuals, and they will, yeah, they can come out. So I would contact them. There's potential in the future that, you know, we might coordinate that as well. We will be presenting at ALAS on this topic as well. Oh, and I think we're also going to be at Priminar. We haven't gotten the Priminar. Priminar, I don't think, has coordinated quite yet, so we don't have acceptance yet, but we submitted to Priminar. We'll also be presenting a short bit on this at KLAS. You know, we present at a bunch of conferences. We'll be announcing a bunch in our newsletter. How can we differentiate between compassion fatigue and other stress or mental health problems, or a combination of cases or causes? So I don't think actually it's totally necessary to differentiate. I think the formal, you know, diagnosis and assessment like that can always be left to mental health professionals. But really, I think as a field, what we can focus on is how we can help. And how we help compassion fatigue is likely going to help many mental health problems or different things. And so providing that really good organizational culture, providing general mental health support, and also addressing the unique factors of working with research animals, of our field in particular. We're going to see what the data says, but from this preliminary look, I really think that 3-prong approach, organizational culture, mental health resources generally, and then, you know, field-specific resources are going to be the way to go when trying to support our staff. And I will, like I said earlier, this webinar is being recorded. It is going to be posted on our website within the next couple days. I'm going to be emailing out all registrants so they can see that. Someone's asking about the survey. So the self-assessments are not NA3RsC run, but if you go to that webpage that I linked above, www.na3rc.org/cf, on the top tab, there's a tab called self-assessment, and that's where you can do the surveys on your own. Yes, and I'm happy. I see great presentation. Thanks for putting this together and offering it to our community. Happy to be here. It is 10:59. If anyone wants to squeeze in a last-minute question, I will answer it. But if I don't see it soon, I will wrap up and let everyone go on with their day. Thank you again, everyone, for joining me. It's truly been a pleasure. I'm honored, and it brings me great satisfaction and meaning to work on this along with everyone. Again, acknowledgements to everyone on this initiative, everyone in this community, everyone who is here today, who is on this webinar. Even by listening, you are doing a small part, moving the field forward, committing to the 3 Rs, moving compassion, fatigue, resiliency forward. So I see you, I recognize you. Thank you so much, and have a wonderful rest of your week. Okay, bye.